Welcome to the Deep Dive. Today we're getting into something really critical, but maybe a bit overlooked. The link between climate change and public health. When you think intense heat, maybe Germany isn't top of mind. But rising global temperatures mean longer, tougher heat waves even there. And that causes real health issues, anything from feeling unwell right up to, well, life-threatening conditions. We're talking thousands of premature deaths each year. It's a serious challenge.
It really is. And the World Health Organization, the WHO, they actually recommend what they call heat health action plans, the HHAPs, to deal with this. So our mission today is basically to understand why these plans, which seem so crucial, aren't fully up and running across Germany. And we'll be looking at the role, or maybe the lack of a clear role, for their public health service, the PHS, in all this. It's quite surprising.
Okay, so HHAPs are the goal, but implementation is patchy. How did the study behind this figure that out? What was the approach?
Well, they did a couple of things. First, a really thorough look at legal documents from all 16 German federal states. And second, they did 16 in-depth interviews with experts in the field. What they found about where the PHS officially stands on heat health, well, it's telling.
Right, you'd expect words like heat or climate to be all over public health laws now, wouldn't you? What did they actually find in those documents?
Yeah, you would think so, but it's a pretty stark finding. The word heat just isn't explicitly mentioned, not in any of the state PHS laws.
None. Wow.
None. And climate, that only shows up in one state's framework out of 16. There are general mentions of environment and health tasks for the PHS, but they're really vaguely defined, so there's no clear legal hook for them to lead on these heat health action plans.
Okay, so if the law is that fuzzy, that sounds like it could lead to inaction, right? What do the interviews say the PHS is actually doing, on the ground?
The interviews basically confirmed that lack of a clear role. Down at the city or county level, the PHS very rarely starts or coordinates these HHAPs. What happens more often is they support projects. But those projects are usually led by environmental agencies.
Oh, okay. So environmental agencies are taking the lead. Why them?
Well, they're generally seen as having more sort of natural ownership of climate protection topics, and crucially, they seem to have better access to funding for this kind of work.
So the PHS is kind of sidelined, legally and maybe financially too. But hang on, you also mentioned experts think the PHS should be a key player. Why the disconnect? What's their unique strengths here?
Exactly. That's the interesting part. The consensus is they should be central. It really comes down to their unique position. The PHS is seen as vital for connecting all of the different health players together. They've got existing networks, crucially, with vulnerable populations.
You mean like older people, those with chronic conditions?
Yeah. Yes, exactly. The elderly, the chronically ill, pregnant women, small children, people experiencing homelessness. The PHS often already has contact points. Plus, they champion this idea of health in all policies. Basically, making sure health is considered in decisions way beyond just healthcare. And they can do quality control, like checking if nursing homes are actually prepared for heat waves.
That makes a lot of sense. So if they have this potential, what's holding them back? Or, what helps them sometimes succeed despite the challenges?
Yeah, the study identified some clear patterns there, hurdles, and sometimes things that help. A really big barrier right now is just dealing with other public health emergencies.
Like COVID, I imagine.
Precisely. Things like the pandemic just soak up resources and attention, pushing non-mandatory stuff like HIPs down the priority list. But on the other hand, a powerful facilitator is that there's widespread awareness now. People and organizations generally get that climate adaptation is urgent.
Okay, so competing crises versus growing awareness.
Yeah.
What else?
Other things that came up were individual motivation, like having champions within the PHS, but also big organizational issues, rigid administrative structures, not enough money, not enough staff. These financial shortages are a constant theme, and the PHS isn't typically the one leading the charge to get external grants for the stables. Environmental agencies often seem better positioned there too. Political support also makes a huge difference, of course.
With all that, especially the lack of a clear legal duty and the resource issues, did the experts think changing the law would be the silver bullet? Was there agreement on needing stronger legislation?
That was another fascinating point. There wasn't total agreement. Some experts definitely felt a strong legal foundation is absolutely essential. They argued it's needed to secure resources, to make it a priority. A clear legal duty forces the issue.
Makes sense. But others disagreed.
Yeah, others argued that the current laws, vague as they are, could potentially allow for engagement if there was the will. They felt that maybe having enough motivated staff and strong networks on the ground might actually be more critical than strict new laws from the top down. There was a worry that just passing a law wouldn't automatically create that needed engagement.
So pulling this all together, what does this deep dive into Germany's PHS tell us more broadly? What's the takeaway for you listening?
Well, it's really a case study, isn't it? It shows how public health systems everywhere are kind of grappling with these new, complex, climate-related health challenges. The PHS in Germany clearly could and probably should be a major player in tackling health and climate change impacts, especially for protecting those most vulnerable. But to do that effectively, they seem to need, well, tailored strategies, probably clearer legal backing, definitely more resources, both money and people, and strong leadership to cut through some of those rigid structures and competing demands.
Right. And maybe final thought for you to chew on, what does it mean when our public health services are constantly stretched, dealing with the very visible emergencies we see on the news, while also trying to battle this slower, almost invisible crisis of climate change that disproportionately harms the most vulnerable people in our communities? Something to consider.